Hey, welcome everyone. My name is Tristan Claridge and I'm the convener of the Social Capital Research Group. Our group promotes the advancement of social capital theories, and we support anyone who uses the concept in research and practical applications. We have an active discussion group of over 1,000 members, and we hold regular webinars from researchers and practitioners. In this session, we welcome Professor Irene van Staveren for a presentation and discussion about social cohesion and COVID around the world. Irene van Staveren is Professor of Pluralist Development Economics at the Institute of Social Studies of Erasmus University, Rotterdam. Her theoretical interest is in feminist economics, social economics, institutional economics, and post-Keynesianism economics. Her key research interest is at the meso level of the economy, with topics such as social cohesion, social exclusion, inequality and discrimination, as well as ethics and values in the economy and in economics. She is project leader of the online database Indices of Social Development. In addition, she is also a member of the think tank Sustainable Finance Lab and on the board of the student initiative Rethinking Economics. In 2015, she published a pluralist economics textbook with Routledge titled Economics After the Crisis, an introduction to economics from a pluralist and global perspective. She turned this book into a MOOC, that's a massive open online course, on the platform Coursera named Introduction to Economic Theories. So welcome, Irene, and over to you.
Thank you very much, Tristan, for this wonderful introduction. Pleased to be here. And very nice to see that participants are from all over the world. I'm in a development school, yeah, it's wonderful to work with people from Africa, Asia, Latin America, all over the world. And the empirical analysis that I will show now in this presentation includes indeed data from all over the world, with an emphasis on the developing world. Okay, so let's get started. Now what I like, oh, it doesn't want to move. Let's see, yes, here it wants to move. Okay, about 10 years ago, I published a book with a co-author, Peter Knorrega from the ISS, where we critically reviewed the social capital concept, theory, and empirical literature. And following on from that, I moved more to the study of social cohesion. And here I would like to go briefly into the why I think social cohesion is often, not always, but often a better term to study the social level, intangible, difficult to measure factors that are so important for understanding all kinds of socioeconomic developments in societies. So first, the limitations of the concept of social capital is how it is often used, and I have to say by economists. I understand this network is an interdisciplinary network, but you know, economists have run a bit away with the concept of social capital, and you know, with the urge for measurement, putting it in utility functions and so on. Now, interesting, the capital metaphor doesn't really match. In general, capital, like machines or buildings, tend to depreciate with use. But that's not the case with social capital. The more you use it, the bigger and the stronger it becomes. And also there is some circular causality in all kind of economic regression analysis of social cohesion or social capital, and all kind of benefits like economic growth or reduction of poverty. But there's some circularity, and on the one hand, social capital is used to explain improvements in certain economic outcomes, and on the other hand, improvements of certain economic outcomes are explained with social capital. So that already hints at the difficulty of measuring it and using it in meaningful economic analysis. More theoretically, the concept of capital, like physical capital, financial capital, human capital, is an attribute, is something of an individual, and you invest in it in order to reap returns on investment. Well, that's difficult with social capital because it's about a relationship. So you need the other or your community to invest in it. It's not a purely individual matter. And the measurement. Economists often measure social capital in a one-dimensional way. They use very, very often the general trust question. Do you in general trust other people? For example, collected by the World Value Surveys, or they refer to a particular social norm, a kind of pro-social norm, like people tend to help each other. Or more in micro research, they refer to networks to see who is related to who. And if there are many links, then that is an indicator for a higher social capital. However, in my research for that book and afterwards, I felt that the social is better recognized in the concept of social cohesion, which is used largely by sociologists rather than economists. It characterizes a community or society, a community more at a smaller scale, the bonding type of social capital, and at societal level, more the bridging type of social capital. So I do recognize there is still some relationship conceptually between social capital and social cohesion, but if we really want to do justice to the social dimension of it, I think it's better to use the concept of social cohesion, because then we recognize that it emerges at the meso level. So not at the individual level, but the level exactly between the individual level is the lowest unit of analysis for economists, and the macro level, the economy as a whole. So in between, there's this meso level, and that is precisely where this social cohesion happens in a way. And the measure of social cohesion is often done with multiple indicators rather than just one-dimensional. For example, with a couple of questions in household surveys, or as I will explain later, with an index at the country level, an index that may contain even up to 25 or 30 underlying indicators. And there's a lot of literature on the benefits of social cohesion for communities and society. Depending on the kind of analysis, you emphasize a particular benefit, of course. One type of benefit is that it enables collective action. And in the database that I will show you a bit later, we have a variable, an index for civic activism. So that is specifically that dimension. Social cohesion also enables social inclusion. And 2 years ago, I published an article in the journal Social Indicators Research, in which I was able for all countries in the world to show that there is a positive and statistically significant relationship between the inclusion of ethnic minorities and social cohesion as the dependent variable. Thirdly, it tends to enable solidarity, and that is also a dimension that's important in fighting the COVID-19 epidemic. And finally, in more business-oriented or market transaction-oriented research, what is emphasized is that it tends to reduce transaction costs. So let me move then to the measurement. What I find important, what I learned over the years, is that we need to use multidimensional measure, but also in context. So that's why I have some problems with this general trust question. This question, do you in general trust other people? And it's very difficult to answer that question without any context being given. And I did some field research with a colleague, with two colleagues in Ethiopia and Vietnam on the shoe industry. And we first used this general question, and people did not really respond, did not want to respond, or kept asking us, what do you mean? Do I trust my family members? Do I trust my friends? Do I trust my competitors? Do I trust my suppliers? Do I trust my clients? So that context is quite important. So then I come to the database that Tristan already mentioned, that I coordinate at the Institute of Social Studies. It's called Indices of Social Development. It includes 6 indices, including the 2 that I will focus on today: intergroup cohesion and interpersonal safety and trust. Now, intergroup cohesion deals with variables like civic disorder or political risk or violence or the risk of terrorism. So the extent to which there are different factions in society that are opposed to each other. Whereas interpersonal safety and trust is more about attitudes of trust or fairness. And I mention explicitly here in context. So there are about 4 or 5 variables of trust. Do you, in general, trust other people? Do you trust your family? Do you trust people you meet for the first time? Do you trust people you already know? And the same for this question of fairness. People in general tend to be fair. Well, this can also be asked in different contexts. And the interpersonal safety and trust index also uses some crime rates. For example, is there a lot of car thefts in your neighborhood, or drug dealing, or have you experienced break-in in your house over the past 5 years? Questions like that. So let me give you a quick glance at the website we have. So this is the homepage of the website Indices of Social Development. And as you can see, it has 6 indices. So as I said, I will use in this study intergroup cohesion and interpersonal safety and trust. But there is one on civic activism that I mentioned. There's one on clubs and associations, the extent to which people in a country are member of all kinds of clubs and associations, sports clubs, churches, and so on. And there's this index for inclusion of minorities that I briefly touched upon. And we have an index of gender equality. And I know there are many other indices of gender equality by the UN, by the World Economic Forum. Our one is the broadest one, and it includes data, access to resources, but also all kinds of capabilities and effects between men and women. So this is the website. You can click on data access and you can download the data. There's no fee, no registration even. It's just open for general use. Okay, now let me go back to the slides. So each of these indices measures social cohesion in its own way. The intergroup cohesion particularly looks at relations between social groups. So it is a signal of bridging social capital. There is some link with bridging social capital. Whereas the interpersonal safety and trust is more about relations between individuals in communities, like a neighborhood. So that refers more to the bonding dimension of social capital. Now, very briefly, because I don't want to be technical about the construction of the indices, but you can find this all on the website. We use the matching percentile method, meaning that we have a country ranking. So we rank all the countries on the first dimension. And then we add the second dimension, which leads to a changing of country rankings. So on the first dimension, a country is number 1. On the second dimension, the country ranks number 3. So the average is that it ranks on number 2. And then we add the next dimension and the next and the next. And then we come up with a more or less final country ranking. And they all get numbers between 0 and 1. But then we do that 1,000 times again in a random way. It's called bootstrapping in economics, or sometimes referred to as the Monte Carlo method. So the purpose is that we end up with a stable ranking of countries on a scale between 0 and 1. Now we have a lot of countries in the database because we allow a country to enter the ranking if it has at least 3 underlying variables. And so for an index that has 20 variables, a country already appears if it has data on 3 variables. We collect the data not every year, but every 5 years, because as you will be very familiar with, social phenomena don't change very quickly from 1 year to another. The benefit of our method is that it uses that it includes almost every country in the world. Okay, coming to the topic of COVID-19 and social cohesion. Of course, there is some logic why these two might be related, both the spread and the morbidity of the virus. If there is strong social cohesion, it's likely that there is more willingness by people to abide by government rules to reduce the infections. So people are willing to give up their own comfort, for example, by wearing a face mask for the sake of the group. Also solidarity, in particular with vulnerable people. So if you feel that you're not worried to catch the virus because you're healthy, you still may be willing to make an effort to prevent harm to others who are in a disadvantaged position. Trust in others to abide by the rules, because if you don't trust others, then, it would be silly if you are the only one washing your hands 10 times a day and wearing a face mask and so on. And some collective action dimension as well. We studied that in a parallel paper. Because in several countries, we see that where the government falls short, there's a lot of collective action at the local level, in particular in developing countries, food distribution, making masks and handing them out and so on, for example. So social cohesion is likely to increase mask wearing and self-testing, going in self-isolation, keeping distance, work at home, and vaccination. I want to make one thing clear here is that we do not include any measure of trust in government or trust in government institutions. Unfortunately, in the literature, I have seen such measures, which people then refer to as measures of social capital. I disagree. I think social capital refers to relationships between people and not between individuals and the government. So here on one page, a very brief overview of the empirical literature. There are broad literature on broad measures of social capital. For example, measures of tight cultures versus loose cultures, or whether there is a community orientation. And the results show that there are less infection rates in stronger cultures or more tight cultures. There are also one-dimensional measures of social capital, often using this general trust question. Lots of literature, and again, we find that when there's more social capital, there's more compliance with policy measures. And the studies that use COVID data also less spread of COVID. Then there are some inadequate measures of social capital, but they come close. For example, the extent of individualism in individual counties in the United States. Very interesting studies by Bian and by Bazzi. And they have a measure of individualism, and they find that the counties, US counties with more individualism actually have higher infection rates. And finally, there's a set of papers on the institutional trust, but as I said, I don't think that's a correct measure of social capital, and the findings are mixed. Also, there's some findings on nonlinear effects of social capital over time. So strong community bonds at the beginning of the epidemic may actually lead to a lot of infections because there's lots of interaction between people. And then later, when people figure out that it may be better to keep to social distancing, the infection rates goes down. And in other communities, probably communities with low social cohesion, you see in the beginning low rates, but then people get tired of the measures or don't care so much anymore, and then the rates shoot up. So the theoretical framework that we use is that we expect a negative relation between social cohesion on the one hand and the infection rate and the death rate on the other hand. So more social cohesion, less infections. More social cohesion, lower death rates. But obviously in a multiple regression analysis, we need control variables, for example, the quality of the healthcare system, the quality of the government in general, the stringency of measures, for example, the type of government, autocracy or a democracy, and the level of GDP per capita. So here is the estimation that we use, and we use data for the year 2020. So basically before vaccination started. So the dependent variable is COVID rates. I have two estimations, one with infection rates and the other with death rates. From our database, Indices of Social Development, we use these two indices, intergroup cohesion and interpersonal safety and trust. The economic measure refers to the GDP per capita and the income level of a country. X stands for government capacity, and the World Bank has several indices to measure government capacity. And H is for a healthcare system. We have both an index of health care expenditures as percentage of GDP and one of hospital beds per 10,000 inhabitants. And Dem Liberal is a measure taken from the Polity 4 and Polity 5 source. It's an index for the extent of liberal democracy or autocracy of countries. Because it makes sense to expect that countries with autocracy can enforce much stronger all kind of rules and enforce people to comply with them. Okay, so these are the estimation results for the number of cases. So this is for infection rates as the dependent variable. The key variable is, of course, the intergroup cohesion, and we see a negative, statistically significant effect. Now, what does it mean? That means that indeed, as we expected, social cohesion going up, infection rates going down. GDP per capita, positive effects. We did not expect that at first, so that in countries with higher incomes, you see more cases. I'll come back to that later. Public services, a negative effect, as we expect. The better quality of the public services, for example, in a vaccination program or for testing, the lower the infection rates. Health expenditure as percentage of GDP, also significant but positive. This is really a bit of a puzzle to us. Then we did two variations. This variation includes 4 types of low income, the poorest countries, lower middle income countries, and the upper middle income countries are the developing countries that are close to developed countries, and then the high income countries. And we see a statistical effect of the upper middle income countries. So that indicates that these results you find in particular for upper middle income countries. And we did another variation with the hospital beds, but that did not have any statistically significant effect. So the interpretation here and the implications of these results for the infection rates is, first, our hypothesis is confirmed: more social cohesion, lower infection rates. Also, that richer developing countries tend to have higher infection rates than poorer ones. And an interpretation might be that there's simply better testing capacity in these countries as compared to the poorer developing countries. We also see, as expected, that the higher the quality of public services, the lower the infection rates. But as I said, the higher health expenditures, the higher infection rates, we don't know. We can't explain. It's a puzzling result, so this requires further research. So a general insight from our estimations is that the infection rates of COVID-19 cannot be explained very well for the poor developing countries. It seems to relate more to the middle and upper middle income countries. Now the table with the results for the death rates. So here the dependent variable is the COVID-19 death rates. Again, our key explanatory variable is intergroup cohesion, and it has a negative and statistically significant effect as before. GDP per capita doesn't have any significant effect, and if there is one, it's very, very, very small. Liberal democracy index, a positive effect, meaning that it ranges from autocracy to democracy. So in democratic countries, death rates tend to be higher than in autocratic countries. For the public services, this one is significant, this one not, but it is at least the negative, better public services, lower death rates. And then on the health expenditure, again, positive, like in the other one, so that is puzzling. And same here, that the upper middle income countries are statistically significant. So our results particularly refer to the upper middle income countries. So our hypothesis is confirmed also for the COVID death rates, more in richer developing countries, perhaps because there's better reporting of the death rates. Now, interestingly, within probably a year from now, the WHO data will be available on general death rates. And then can we see that then it's only possible for us economists to use that data to see whether there was an underreporting of COVID deaths. If you see the trend of a death rate in a country over, say, the past 10 years, and suddenly the death rate shoots up, and the difference is much bigger than the reported COVID deaths, then probably there was an underreporting of COVID deaths. So economists are eager to learn about these mortality rates. I recognize it's a bit morbid, but you know, we're all after numbers as economists. Here, the more democracy, the higher the death rates. Yeah, probably autocracies either can enforce the policy measures against the spread of the virus better, or they manipulate the death rate. Because there's no democratic control. There's no journalists, no independent journalism, no independent newspapers, often no really functioning independent parliament. So it may also be the case that autocracies manipulate death rates. So again, like before, the death rates, like the infection rates, cannot be explained very well for the poor developing countries. And this point on autocracies. Then I have a final table in which I also include interpersonal safety and trust, but as you see, it does not have a strong and certainly not a statistically significant effect. So we don't confirm our hypothesis using the index of interpersonal safety and trust. But the other findings are similar. So the conclusions. Intergroup cohesion gives strong and significant results, meaning that more social cohesion is correlated with less infections and less death. Interpersonal safety and trust gives moderate but not significant results. And remember, the intergroup cohesion was more at the meso level and the bridging type of social capital. And interpersonal safety and trust was more at the community level, the local level, and more about the bonding type of social trust, of social capital. So in a way, what we found here in the language of social capital is that there is an effect of bridging social capital in the direction that we expect, but not an effect of bonding social capital. This last table I showed you included also mobility data. We took data about global tourism and movements between countries, but that did not have really an effect and did not change the results. Then coming back to the positive effect of GDP per capita, yeah, more testing perhaps, or also the demographic characteristics between countries. In the poorest developing countries, there's a very young population, and the life expectancy is low. And we know from about the virus that it particularly affects elderly people and people with health conditions like diabetes, for example. Well, these populations are very small in the poorer countries, but they're particularly high in upper medium and high income countries. So that is also now a new debate among development economists, or economists in general, studying the COVID effects, that, well, perhaps this disease is not really so relevant in the poorest developing country as compared to other diseases. We have very high child mortality rates. Well, that is probably still much more urgent to solve than the COVID cases in these countries. And it may perhaps also explain why there's not only little supply of vaccines to the poorest countries, but also not very eager demand for it, because there are more urgent health issues to solve. Okay, nevertheless, I was quite pleased with our results, but there are still puzzles that need to be solved, like this positive effect of the healthcare system, although that may simply be another indicator of a rich country. And the better healthcare system, it's a richer country. So perhaps there is an interaction there. And a significant positive effect of income level, particularly where is this boundary? So we would like to go into that a little bit more. But yeah, what I think is an interesting finding is that there seems to be more an effect of the bridging social capital type of indicators than the community or the bonding level. Hence more the social cohesion at the societal level and less the social cohesion at the community level. Now, what the policy implications are of this, that is something that we may also want to discuss here in the discussion. So thank you for your attention.
Thanks, Irene. So we'll have some questions now from the audience. So feel free to either put them into the chat, and I can see there's already quite a few in the chat already. Or you can raise your hand within Zoom and we'll get to your question just as soon as we can. So within, to raise your hand, you go to the reactions little button down the bottom within Zoom, and you can raise your hand that way. So perhaps we'll go to the first question from Shirley, who posted a question in advance. So if you'd like to unmute yourself, Shirley, you'd be welcome to ask that question or something that is similar or relevant.
Okay, thank you, Irene, for joining us tonight. And so it's very interesting, your outcomes, and I would be interested to know more if possible. I'll go to your website and have a look in any case. And recently I've been studying at the Hogeschool Utrecht, and I have a project in our neighborhood to study how people can bond and bridge better in a better way. And I myself am half British and half Dutch, so I have a kind of a different view than most Dutch people on society. And I find that people are very individualistic, and they're very proud of that. However, the Dutch are realizing that maybe something is wrong because there's a lot of loneliness. And I was wondering if you have any idea on how one could tweak some different things to help people be more, community minded and that type of thing.
Oh, that's a difficult question. It's clearly not what I studied here in this study. I I know there's a lot of research by political scientists addressing this question. So I would point you at that kind of literature in political science, where they address these questions of not only what is the level of social capital or cohesion in a community, but also what are its determinants. But I did not do any research on this.
Okay, thank you.
Okay, should we move on to the next question? Dr. Fickwald, you have your hand up. Feel free to unmute yourself and ask your question.
Okay, thank you very much, Professor Irene, for your wonderful presentation. My question is on the way you conceptualize the link between social cohesion and COVID infection. Do you think that the link between social cohesion and COVID infection is unidirectional, in the sense that COVID infection can have also an effect on social cohesion? For example, during COVID infection, people become less, people tend to socialize less, they interact less, they spend most of the time indoor. As a result, they will lose up their social bonds, they will lose up their social cohesions. So in my view, I don't think that the relation between social cohesion and COVID infection is one way. COVID infection has also its own effect on the social cohesion that different societies have. If this is the case, have you ever considered this factor in your analysis? That's my question.
Thank you very much. Indeed, an important question. It's the kind of reverse causality question. And we, in a parallel paper that I briefly mentioned, we use civic activism as a dimension of social cohesion. And there we do expect that there is a reverse causality. And we're trying to disentangle that one. For the other aspects, I think it is reflected a bit in the non-linear effect that I mentioned, that is captured in some of the literature. So that is, I think, the reverse causality kicking in after some time. And of course, we're living with this epidemic almost 2 years or 2 years now. And I think the longer it takes, the more we will see the other effects. The person who spoke before you mentioned loneliness in the Netherlands. You mentioned less contact, less interaction. And that is clearly indeed happening. And that's also something that can be compensated a little bit with digital connections with other people, but only to a limited extent. So yes, I agree that there is probably increasingly a reverse causality as well, but I just started analyzing that.
That seems like a really complex part of what social capital is, because just because people aren't talking to each other or seeing each other doesn't mean that social capital doesn't exist, you know. And I think if we take, say, Bob Putnam's approach to measuring social capital and just simply looked at something like, you know, participation in voluntary associations, if people stop going to clubs, then you could say social capital doesn't exist. But we know that's not true. You know, we know that people still have all of the sorts of, you know, norms and trust and individual relationships, regardless of whether they are attending clubs. So I think, you know, the question and your research is highlighting how complex all of this is, that it's difficult to identify, it's difficult to observe, because it doesn't necessarily present in the same sorts of ways that other factors do.
Well, yeah, this is very complex to measure. I agree with you. But then we have perhaps to distinguish between the kind of stock of social capital and the investment in it. Like a football club, we'll have new members every year, but these little kids of 5, 6, 7 years are kept at home for 2 years. So there is some effect to it, but on the other hand, it may catch up very quickly once the epidemic is over. So that it asks from us to think about how we can measure such probably temporary effects.
Yeah, absolutely. Well, should we move on to the next question? I think we have a question in advance from Sean Kavanagh. Feel free to unmute yourself and ask your question.
Kia ora, Irene, how are you? My question is about basic income. The Netherlands is a site for different trials that are happening. So I was going to ask you, when you hear of basic income as a concept, what figures come to mind, either historical or contemporary, and how does that association change your perception of basic income?
Oh, complex question, Sean. It is likely, of course, that the basic income frees up people's time to engage in all kinds of community activities. So I would expect a positive effect of the basic income on the kind of bonding social capital within communities. But about bridging social capital, that may even be a negative effect. Because lots of one's networks depend on one's work relationships. And quite a share of people receiving basic income will decide not to engage with formal paid work anymore. So their worlds will probably become a bit smaller, strengthening the bonding social capital, but weakening the bridging part of it. That would be my hypothesis, but I haven't seen any research on this yet.
Can I just add to that? The question was really like, what figures come to mind, and how does that shape your perception of it, of basic income? Like, I know in the Netherlands you've got Rutger Bregman, who wrote the book Utopia for Realists. It's one example. Another example might be Scott Santons in the US, who refer to basic income as a social vaccine. You know, they're just two examples.
Yeah, I know the book by Rutger Bregman, and I find it is really fascinating. But I can't think of any researchers who really do this nitty-gritty empirical research that needs to be done over a longer period of time. I would not know of anyone. But again, like with the first question, you should not look for economists, but sociologists and political scientists to do that kind of work.
Yeah. Okay, should we move on to the next question? We have one in the chat from Shweta. If you would like to unmute yourself, you can. Your question is, can this cohesion between different groups lead to the opposite with people of other groups? So I think the question is in relation to like in-group effects relative to out-group effects, if we use more sort of psychology terms.
Yeah, indeed. Yeah, we can think in terms of trade-offs. If people invest too much in their own group and too little in the connections with other groups, that may even lead to distrusting of other groups, of the whole idea of us versus them. So, and yeah, that is also a bit that Robert Putnam looked into. And that has been tested in lots of social psychology experiments. But with my kind of work at the cross-national level, it's more difficult to study. However, the paper that I referred to briefly in my presentation that I published in Social Indicators Research was actually a reaction to literature on using the variable of ethnic fractionalization. a variable developed by Roberto Alessina, who used data on different ethnic groups in a country. So the more ethnic groups you have in a country, he referred to that as ethnic fractionalization. I feel very uncomfortable with the term because fractionalization has a negative connotation. Whereas what he measured was simply the number of ethnic groups. So does a country have 1 ethnic group, 2, 10, 20? That's what he measured. And then lots of the literature by himself and others suggested that countries with more ethnic groups have lower economic growth and are poorer and so on. So the suggestion was more ethnic groups, it's worse for your economic development. But as an economist, I thought that's strange because markets flourish with diversity. You know, if you go to the supermarket and there's just one type of apples and one type of bread, then you're disappointed and you look for another supermarket where there's more diversity. You know, we as consumers, we like more diversity, and suppliers can compete better with each other with more diversity. So I would expect that more diversity actually leads to better economic development. And that's why I did this paper where I included a measure of how different groups relate to each other. And because obviously, if there are ethnic groups, irrespective of the number of them, that are in conflict, obviously that's not good for economic development. So that's why I included the measure of the inclusion of ethnic minorities, and countries that have many ethnic groups, but includes them, have social policies to include them, policies against discrimination, tend to have much better economic outcomes. So yeah, in that case, it was possible to measure something along this line at a macro level. But I find it in particular important to engage in those discussions because I find it quite dangerous that first people mix up diversity with fractionalization, and then in their econometrics don't use the correct control measures to distinguish simply the number of ethnic groups with how ethnic groups behave vis-a-vis each other. So thank you for this question, because it's really a very important topic, and I want to come back to that after my COVID research.
I think that's really important. And Shweta, feel free to unmute yourself if you'd like to follow up with any further questions.
Thank you very much for the answer. Thanks.
And so if you don't have anything further, Shweta, I just wanted to follow up a little more because I think, Irene, like it seems that, and it really bothers me when I see people, researchers, who basically say that diversity is poorer social capital, you know, and it makes that correlation. But there's no causation there, really. I mean, there's other factors, of course, like you're saying, like there's other factors that play into that equation that maybe you know, ethnic diversity might relate to poorer social capital where there is those sort of, you know, negative views towards other ethnic groups. But it's the assumption really bothers me every time I see it in research. And I think it's something that social capital researchers need to do better on in general. And it's really great to see you taking those factors into account in what you're doing.
Thank you.
So I think a follow-on question, we can't really get away from it, you know, communities of misinformation or disinformation or, you know, sort of alternative views. Like, is there some way we can take that into account? Because these communities, it seems, have, you know, really strong social cohesion, but the outcomes for COVID response probably isn't quite so positive.
Yeah, that's why I mentioned these studies by Bian and Basil on US counties. I found it fascinating studies. Because they were looking for a measure at the county level for, well, social strength, cohesion, whatever, but they come up with a measure of individualism, which is not exactly the opposite, but comes close. So I think it's okay. It was creative. And they did that by using a database on the frontier mentality. And, you know, in the US, the frontier moved from east to west. So countries that were the longest at the frontier apparently have stronger feelings of individualism. Makes sense. They had to fend for themselves. You know, it's a whole different story about gun laws today, but in those times, you needed to have a gun to defend your own community. There was no government, there was no protection, no police, no army, nothing. So understandably, in those counties that experienced quite a long period of time to be at the frontier, there was more individualism. And the interesting thing is in those counties, people abide less by the protective measures of face mask wearing, lower vaccination rates, because apparently there's still this culture, we manage this on our own. We don't need any government telling us what we should do. But unfortunately, those counties have higher COVID infection rates and higher COVID death rates. Now, coming more to your question, how can we change this? What can we do about this? Of course, you don't change such an ingrained mentality in people. Nevertheless, as a scientist, I believe in the force of information. So I think information is important, but probably it matters per community how this information is given and by whom. And many of these communities tend to vote Republican. Well, then it doesn't help if a democratic state government gives this information. Perhaps you should get some democratic voting doctors and nurses going into the communities. And so, yeah, I think you can only change people's mentalities and views when they come from a long history of cultural values, more on a one-to-one interaction, rather than with kind of basic news station provided information.
So do you think that some of the ways we might measure social cohesion or social capital might be very strong in these communities of misinformation or disinformation? And so we might be, it might be compromising our data a little bit. You know, we're getting strong senses of community cohesion, social cohesion existing where there's a positive response to COVID, or more positive response to COVID. But at the same time, we're seeing the same sorts of measures of social cohesion in these communities of misinformation that is resulting in negative outcomes. And so that's sort of, it makes it difficult from a, you know, from a data collection and analysis point of view, because and I guess my question is it somehow possible to separate those? Like, can we, maybe it's just too difficult, but can we actually ask about, you know, you don't have a data for this, ask about the type of community views that exist to try to separate those communities? I don't know, maybe it's too complex.
Well, in a way, we did this in this paper, at least we attempted at this, by distinguishing the intergroup cohesion measure and the interpersonal safety and trust measure. And the interpersonal safety and trust measure was more at the local level, the community level, more bonding type of social capital. And we did not find a significant impact on COVID. So yeah, in a way, we already tried to do that. So I think we should never mix up bonding and bridging social capital. We should, that's why my plea for contextualizing your measurement of social capital.
Yeah, absolutely. I agree with that completely. So there's a question in the chat from Anna. If you would like to unmute yourself, you'd be welcome to ask your question. Just give you a moment if you want.
Oh, hi. My name is, thank you. My name is Anna. I'm from Colorado State University. I'm a graduate student, and I'm about to start my project on looking at the impact of COVID on social trust, basically. And what I've found is that social trust is probably a little bit different from your social cohesion, but I think it's still within the realm of social capital. And what I found is that social trust can be divided into two. One is interpersonal trust and institutional. and trust on government falls in there. But I was wondering what your take on this is in relation to social cohesion. Thank you.
Well, what I do as an economist, I sometimes use trust in institutions like the government as a control variable, so that I'm sure that I'm not picking up that effect when I measure interpersonal trust.
Thank you.
You're welcome.
Okay, next question is from Jay Riverside. If you would like to unmute yourself, you could ask your question.
Wait a minute. Thank you, Tristan. Quite interesting. This seminar is an excellent one. It is about the current issue which we have in Mexico and all over the world. I was thinking about the equation that the professor presented, and it includes basically what the Human Development Index measures, which is mortality practically, and income, and but not education. Will you consider it as a factor for diminishing or increasing the effect of the social cohesion or social capital?
Yeah, I'm very familiar with the Human Development Index, and in some of my research, I've used it. I did not find it very practical here, because the measure to me is too broad. And in the kind of research question I like to address, I found it more useful to use targeted measures for healthcare, for example. In the Human Development Index, the health index is life expectancy. Well, that's a very crude measure of health. So when you want to study COVID death rates, it makes more sense to include the number of hospital beds in a country per 10,000 inhabitants instead of the life expectancy. But for age, we did use a control variable, the proportion of the population over 65, because we expected countries with a higher proportion of elderly people have higher death rates. But it didn't come out, because probably that only referred to the developed countries, but did not distinguish a lot between the various groups of developing countries. So yeah, I like the Human Development Index. I find it important. But on health in particular, I think we needed more focused, more targeted indicators.
Thank you. Can I ask him just a quick follow-up question?
Yes.
Tristan?
Yes.
I was thinking also about the use of the democracy index. Well, not the democracy index, but what about the type of government and type of regime? And I think that's quite important, because there are many key issues within the public policy of health design, the health policy design. And I think that's quite a difference within the results among the countries. Basically, Mexico, we have it was a flawed policy, it still is, and we're not getting there anywhere. Still, we're hoping to be within May or April or May, within the same condition as South Africa. That's what they supposed to will look alike. And what about this, the health design, the policy health design? Do you think it will be really interesting to recover it for the social index, the social cohesion index? Excuse me, I'm a little bit rusty.
No, but I think it's an important control variable for the estimation, but we could not find a variable that really measure the quality of the health system as such. So we had to use proxy variables. The hospital beds was one, and which was not statistically significant to our surprise, and the yes, it was in some of our estimations, but also the percentage of health spending as a percentage of your GDP. But of course, we would like to have a measure on the quality of the healthcare system in general, because there's much variation. We know, for example, Cuba is not a high income country, but has a very high quality healthcare system. So yeah, it would be nice to have a good indicator on that. I'm open to it.
Thank you very much.
So if anybody else has any other questions, feel free to put them in the chat or to raise your hand. We're coming towards the end soon. So there is one more question in the chat from Hanada. Apologize if I didn't pronounce your name correctly. Feel free to unmute yourself if you like, but they're asking about what you think about linking social capital. Can that be classified as a third type alongside bonding social capital and bridging social capital, or should it be included within bridging social capital?
I've always feel a bit uncomfortable with the term linking social capital. For me, it's a typical way of for economists to evade the word power. But obviously it's about power. You know, if you're well connected to people in power, of course you have more opportunities. But, you know, many economists are comfortable using the word power, so they come up with linking social capital. Well, I'd rather just talk about power then.
Yeah, it makes sense. And I think by including linking social capital, we often then try to say that bonding and bridging are both horizontal forms of ties, and that we then reserve linking as the only form of ties that's hierarchical. But realistically, all ties end up with some form of hierarchical relations of power. There's forms of power dynamics in every relationship is basically what I'm trying to say. And I think personally, by using the linking category, we're basically putting all considerations of power into that form of tie, and therefore we can ignore them in the bonding and bridging distinction. But that's my belief about it.
Yeah, no, I agree. That you know, if you live in a small community, also very often in a small community, there are people with more power and people with less power. So that we should not ignore that. Even though people are all well connected in a small community, some have more access to those with more resources to distribute than others, for example.
Yeah, absolutely. So anybody else has any final questions? We're coming towards the end. So last opportunity to get a question in.
Nothing in the chat, Tristan.
No, we haven't missed anything, Marion?
No, we haven't missed anything.
Okay, it's good to know. Well, let's wrap it up there. Thanks very much, Irene, for the presentation. We really appreciate the time you've taken to prepare and present, and it was certainly a really fascinating presentation. And as a qualitative researcher myself, there's so many things that came out of that I'd love to be able to explore in more detail. So thanks very much on behalf of the entire group for your time and effort.
You're most welcome.
So our next webinar is going to be in a week's time, and it's going to be by Dr. Esther Villalonga. And she's going to be talking about the measurement of social capital. I think she's going to be particularly focused on the quantitative measures of social capital. So I think it's going to be a really interesting presentation for anyone who can attend that one. And keep up to date with all of the events that we have. We have webinars and discussion groups every sort of week or every 2 weeks. So anyone who's interested, you can check the website and the Facebook group for further events. So thanks again, Irene. Let's end it there.